Good evening, friends. This talk is about the molecular hydrogen therapy, a new miracle molecule in medicine and musculoskeletal disorders. Hydrogen is the most abundant molecule in the universe. It is just diatomic hydrogen H2, which is the lightest of the molecules, and hydrogen atom is the smallest of the atoms known to mankind. Yet, hydrogen is not available in its molecular form on our Earth. Hydrogen is the most powerful antioxidant known to man. In combination with water, hydrogen and oxygen occupy 66% of the Earth's surface. So, hydrogen as a compound is the commonest substance known to mankind, essential for all plant and animal life. But hydrogen in its molecular form, a very powerful oxidant, is not present on this earth. Acting at mitochondrial level, the antioxidant effect of hydrogen has been found to be age regressive, performance enhancer, and useful in COPD, cancers, allergies, and numerous other conditions. In the current scenario, one does not need to be a patient to be inhaling or getting hydrogen infusions, because even in normal people, hydrogen inhalation and infusion produces very good health benefits. Mixed with water soluble vitamins, the new IAOS methodology is revolutionary in clinical practice. Pollution, pesticides, contaminants, climate change all cause oxidative stresses to us. And this produces brain fog, tiredness, weakness, lethargy, anger, stress, sleeplessness, and lot of other associated issues. Vitamin C, vitamin B12, vitamin B1, B6 are known to be antioxidants, water soluble vitamins, which get out of the body within 24 hours. Hydrogen in molecular form is by far the most powerful antioxidant known to man. Hydrogen can be inhaled, dissolved in drinking water, diffused in saline, or can be given intravenously. To produce 99.99% pure hydrogen, a hydrogen generator is needed. Medical hydrogen generators were hitherto not available in India, and the initial machines were costing 30 lakhs. Subsequently, the machines cost about 10 lakhs plus. IAOS has recently introduced affordable medical hydrogen generators for clinical applications. I acquired one recently, and after thorough review of literature, got myself infused with an antioxidant cocktail. Subsequent video shows complete steps of antioxidant and hydrogen infusion. The first subject is my sister, a gynecologist, and the second is the IAOS scientific officer, Chandraja. The complete steps are shown in the video step by step. IAOS will soon introduce the book and course on molecular hydrogen therapy. This is just an introduction to the subject. The first batch of IAOS imported German machines with Imported IAOS machines with German membrane and warranty are now available at very affordable prices. Please message me in WhatsApp at the above number 97910200615 for details. Please not make phone calls, and hope that you enjoyed watching this video as much as I enjoyed making this. Welcome to the new way of learning from Indian Academy of Orthopedic Surgeons. Enjoy the video. This is a hydrogen generator. We have a power cable, a water in, a water out, and the top portion has a voice activated control. We must ensure to use only distilled water without solutes into the machine. The power point is inserted and connected to a 230 volt input. Once the machine is switched on, the top on off switch is red. That is the point for taking out the distilled water, and the white cap is for filling distilled water. Once you switch on, we can increase the timing for as long as you want in 30-minute intervals, and in 5 minutes through two outlets, hydrogen and oxygen will start bubbling. If you have a stainless steel diffuser stone which is supplied with the machine, we can pour ordinary water, drinking water, into a tumbler. As hydrogen escapes through glass, if we are making hydrogen water in a glass bottle, we must drink it immediately. Otherwise, we can use an aluminum or a stainless steel glass for longer duration of lasting of the water. The filter must be dipped to the bottom of the bottle, and we can see that 99.99% purity hydrogen is being prepared, and this will alkalinize the water. We can see the pH change, and the water taste actually improves when you drink hydrogenated water. The patient doesn't feel much of a taste difference. We can now remove the diffuser stone, which is made up of stainless steel, and we can connect an inhalation apparatus which will allow direct inhalation of hydrogen, which the patient or subject, in this case, this young lady is a normal subject who wants to benefit from the oxidation effects. She is an IAOS employee, and we are fixing the nasal tube over her nostrils, and 600 ml of 99.9% pure hydrogen is being administered by the machine. Hydrogen is colorless, odorless and tasteless. Here we are demonstrating once more how to attach the breathing apparatus to the machine so that the patient is comfortably breathing hydrogen. In Canada and Japan, they have hydrogen parlors where patients pay fancy amounts to go sit and breathe 45 minutes to 1 hour of hydrogen. After the period of breathing is over, we can switch off the machine. Before that, we disconnect the breathing tube. Then we switch off the hydrogen generation, remove the hydrogen tube, unplug the machine, and the machine is ready to be put back into its box. When we are giving the IAOS antioxidant regime, we are using 1.25 to 2 grams of ascorbic acid, vitamin C, intravenously. That is given into a bottle, 500 ml bottle of normal saline. Here some of it splashed because I did not use a lower loxane, so I am adding a little more, so that now I have about 1.5 grams of water soluble vitamin in the saline bottle. I have left the needle into the bottle so that I do not make multiple punctures and the bottle does not leak. After this, we take 1 ampule of vitamin B1, B6, B12. I am using trade name polybion here, which is now being injected into the bottle. After that, we are using vitamin B12, another ampule, and that is also mixed. We now have a normal transfusion saline set which goes into the bottle. Hydrogen will escape through transparent bottles. However, we don't need to hyper pressurize the bottle, so we attach a tri-way and only give about 400 ml of hydrogen per minute as continuous infusion, while the antioxidant solution is being transfused to the patient. So another saline set is used. We connect the tri-way, we attach a thick needle of 16 gauge, and this part is now, after adjusting the tri-way, pushed into the hydrogen machine so that the gas can be bubbled, and the same is inserted into the bottom of the bottle near the neck so that hydrogen is bubbling through the bottle. To prevent hyper pressure into the bottle, 1 or 2 large bore needle air vents are introduced to the proximal end of the bottle as airways. An appropriate vein is selected, and once we have located the vein, we attach the transfusion system. Here hydrogen is being generated, being bubbled into the antioxidant solution. 2 needles are there on the top to take away the excess hydrogen, and the same is going into the body in the form of a very strong antioxidant solution. We can handle 2 patients at the same time. From another vitamin C bottle, we are extracting 1.5 grams of ascorbic acid, which is being put into a normal saline bottle. We are now adding an ampule of vitamin B12 into the same solution. We do not remove the needle from the transfusion bottle because we do not want to make multiple punctures in the transfusion bottle and cause leakages. So everything goes through one single needle, and the water soluble vitamins are thoroughly mixed. We now attach a transfusion set, prime transfusion set, to ensure that all excess air is taken away. We add a 3-way to the part of the set that will go to the hydrogen machine. The duration is set to whatever time. It's going to take only about 20 minutes for the infusion to happen, and this part is now injected into the bottle after appropriate airways are put on the upper level. We can see hydrogen is being infused in the bottle. The antioxidant solution is thoroughly hydrogenized by molecular hydrogen, and now this is injected into the subject at a rate of 40 to 60 drops per minute. We must warn the patient that if the speed of transfusion is very rapid, she may feel a little bitter taste in the mouth, or can feel vitamin C or B complex being resecreted into the saliva. This antioxidation nutraceutical therapy with hydrogen infusion dramatically increases the energy levels and increases the performance in the gym or physical performance the next day. I personally had the first infusion myself, and my normal walking in the morning is about 8 kilometers, but in this case I walked a total of 16 kilometers. So you can see that we can handle multiple patients at a time, and every patient gets his or her prescribed desired dose of nutraceuticals and hydrogen. This therapy is not only for patients but for also normal individuals who want to combat their oxidative stresses with antioxidants. As no heparin has been used, a simple plaster is enough. After the transfusion, the subject can leave shortly and can drive a vehicle or a car home. If you are interested in learning more about hydrogen therapies or in buying a hydrogen machine, please feel free to message me in the above number in WhatsApp, and I will be happy to send you details. Hope you enjoyed listening to the lecture as much as I did in recording it. Thank you. This segment is me receiving my own antioxidant and hydrogen infusions, which these days I do once in 6 weeks or 4 weeks. Here I am taking 2 grams of vitamin C, water soluble vitamin, the same is being injected into a 500 ml of saline bottle. The needle is not removed because we do not want the bottle to leak. We then inject 2 ampoules of polybion or neurobion B1, B6, B12. Then inject 1 ampoule of vitamin B12 into the same bottle. Subsequently, the bottle is primed, the drip set is filled with the fluid so that all air bubbles are removed. It is hung. We need 2 airways to ensure that whatever hydrogen is being bubbled in will go out with the same speed. On the bed beside me is my younger sister who is having her MAHD. Here we are having 99.9% purity hydrogen, 600 ml per hour being bubbled through the machine. The excess hydrogen is being taken away by the extra air vents in the top. A small butterfly is inserted and the drip set goes into my cubital vein, and we keep the speed at about 40 to 60 drops per minute so that 500 ml of hydrogenated antioxidant solution will be transfused in my body within about 20 minutes. You can see the flow of hydrogen in the bottle. We have kept an air vent in case the pressure in the bottle goes high. The air vent will open up and will ensure the plastic bottle doesn't become distended. The whole procedure takes 10 to 12 hours. It can be done reclining in a coach. And here my sister has finished her ozone MAHD and she now wants a 45-minute inhalation of hydrogen, which is now being done for her. Hydrogen, being the most powerful oxidant, acts as antioxidant, acts both intravenously and nasally equally. Thank you.